dietary considerations with intake of the different food groups. Carbohydrates of the total caloric intake each day. The total carbohydrates should be limited based on individualized testing, and the amount of exercise and activities, and other factors. This includes the severity of diabetes, prediabetes, BMI, activity and medications. Diabetics need to consult their physicians and healthcare providers to properly regulate their individual dietary needs. Fats. Saturated fats should depend on the individual's metabolism and metabolic needs. Many people are not aware that we can die if we do not have adequate intake of the essential fatty acids. Broken fats are the partially hydrogenated fat or trans fatty acids should be avoided included in our diets, whether diabetic or non-diabetic. There is an excellent review of fats in Dr. Buckman's book called The Alkaline Diet and Anti-Aging Protocol, that is anticipated to be published in 2004. Cholesterol levels should be less than 200 mg/d. Total calories per day should be around 1800 for the average type 1 diabetic, again depending on activity level, age, and metabolic rate. This may be very low in the insulin-dependent type 1 diabetic who may need over 3000 calories per day due to activity. Proteins. Proteins are a vital part of the body's metabolism and function. Most plasma proteins are produced in the liver, except for the immunoglobulins. Protein need can be from 30 to 60 grams per day. Amino acids are important in protein synthesis and other reactions in the liver. Some amino acids are precursors of glycogenesis. Proteins and their metabolism are vital for adequate nutrition. Liver and kidney disease pose serious problems for patients with their nutrition because of nitrogen balance and processing of proteins. In liver disease, the ammonium levels can be high if there is a nitrogen balance, and in renal disease there can be elevated blood urea nitrogen. In normal healthy patients, proper balance of proteins is needed, especially that of the essential amino acids. Raw foods that are organically grown are the best source of nutrition. They include the needed minerals, antioxidants, protein, carbohydrates, and they have a high ORP rating. This allows the body to be more alkaline and improves health and wellness, better energy, and better glucose control. Unacidic state, lactic and ketoacidosis just makes diabetes worse, its complications more prevalent, with joint pain and glucose harder to control. Fasting. The potential problems with fasting are many. There are also potential benefits, especially in certain ketogenic diets. Knowing the metabolic needs for each person is critical. For most people, fasting will reduce the metabolic rate since the body thinks that is starving and conserves fat and weight. It may be dangerous in diabetes due to the rapid formation of ketones and acidosis. There is loss of needed electrolytes, nutrients, and proteins. It is far better to take in a small portion of food like some raw nuts and go exercise. This will improve metabolism, improve the peristalsis of the intestine, which is the wave-like motion of the bowel to move intestinal contents down the GI tract. The body no longer thinks it is starving and glucose goes into the cells. Blood circulates to the organs better, and the whole digestive and metabolic system works better. Exercise. Avoid straining Valsalva maneuvers such as heavy weight lifting if blood pressure control is an issue. Aerobic exercise is best for optimal metabolism and conditioning. Pulse rate during exercise is based on age and level of conditioning. The usual target rate is 120 to 140 per minute, but varies with age and conditioning. Exercise 3 to 7 times per week. Altered lipid metabolism and pathogenesis of cancer in adverse metabolic states. 1. Excessive lipolysis. 2. Increase in free fatty acid production. 3. Increase in free fatty acid oxidation. 4. Impaired glucose oxidation in cells. 5. Less glucose utilization due to insulin resistance. 6. Depressed pyruvate dehydrogenase complex activity. 7. Less myosin ATPase activity. 8. Less sarcoplasmic reticulum calcium uptake. 9. Degradation of membrane enzymes needed for cellular activity. 10. Lower pH at cellular level. 11. Acidosis shift means less O2 is carried to the cells. 12. Inflammation and mitochondrial damage.